smell and taste loss is common. It affects around 20% of the population. We will talk about the top 5 causes of smell and taste problems. Smell problems are more common, but if a person has taste issues, with high probability they will have impaired smell also.
First, let's say how we smell. Molecules in the air called odorants enter into the nose during breathing or sniffing. They bind to receptors in our nasal cavity, usually at the top side of the nasal cavity. These receptors send electrical signals via the olfactory nerve in the brain, and the brain interprets this signal as a smell. Humans have around 400 different types of smell receptors in the nose. But each molecule is complex, so it can bind different types of molecules, and eventually we can differentiate millions of different smells. And even between molecules with slight differences, we still can differentiate them as different odors.
Taste receptors work slightly differently. We have 5 major types of taste receptors: sweet, salty, sour, bitter, and umami. Savory, associated with amino acids. We have taste receptors primarily on the tongue. Some of them are on the soft palate, pharynx, and upper part of the esophagus. Unlike smell, we don't have many combinations. A specific receptors focused on a specific molecule. For example, a sweet receptor detects sugars or artificial sweeteners. Salty detects sodium ions. Sour detects hydrogen. Bitter detects various chemicals, often toxic in nature. And umami detects glutamate and related amino acids.
Smell and taste receptors work together to create a full perception of flavor. For example, when you are eating a strawberry, it is mostly due to its aroma, smell, not because of sweet. And when you have your nose blocked due to a cold, food seems bland because the smell component is missing. You can taste meat, mushrooms, and other foods via umami receptors, which detect the glutamic acid and several other molecules. Umami is a Japanese word and means delicious and savory. And we can feel a fatty taste with specific receptors which can interact with fatty acids. In the case of meat, during cooking or aging, like fermented products, it releases free glutamates. That's why we feel protein taste even though we have no specific receptor for meat and proteins. The most common cause of smell and taste problems is respiratory infections like the common cold, flu, and COVID-19. For example, almost 80% of COVID-19 patients experience temporary smell and taste loss. It causes a sudden loss of smell and taste. Loss of smell is called anosmia, and loss of taste, ageusia.
In the case of mild cases, such as common cold and flu, loss of smell usually happens due to congestion in the nose and mucus production, which blocks olfactory receptors. It happens in almost 20–40% of cases of common cold and flu. After common cold, taste and smell will recover. Within 1–2 weeks after nasal congestion resides, while COVID-19, it can last for some period. During COVID-19, the virus damages the epithelium, which supports and is crucial for olfactory nerve function. The olfactory nerve usually remains intact. That's why, in most cases, after some period of time, the sense of smell will recover. After COVID-19, smell recovers in 4 weeks. In some cases, it can need months. And in 5% of cases, even more than a year, there are cases viruses can damage nerve tissue itself, and in this case, loss of smell is permanent.
Usually, taste remains intact. But without smell, a poor smell, a person loses the ability to detect complex taste because the brain is unable to detect full taste without smell. For example, you feel that an apple is sweet but are unable to catch its apple flavor. The second most common cause of loss of smell is sinusitis and nasal polyps. They affect almost 20% of the population. Blocked nasal passages reduce air-reaching olfactory receptors. It impairs smell and taste. The third most common cause is head trauma and brain injury. It is seen in 10% of traumatic brain injuries. In this case, loss of smell is sudden after head trauma. And fourth, aging. Almost 50% of adults over age 65 have a loss of smell. It happens gradually, and also there is decreased taste sensitivity. It happens because with age, gradually the olfactory epithelium, tissue and neurons, which transmit signals to the brain, are degenerated. Also, the ability of regeneration of neurons decreases with age. It happens due to cumulative damage due to pollutants, infections and toxins.
Most cases of age-related loss of smell are natural and gradual and start after 60. It can be an early sign of Parkinson's and Alzheimer's. 60–80% of people with Parkinson's experience loss of smell many years before other symptoms occur. Also, people with persistent smell loss indicates sinusitis and nasal polyps in many cases. Some nutritional deficiencies, lack of vitamin B12 or zinc, can impair smell. Some medications can cause loss of smell. Such medications are antibiotics, antihypertensives such as ACE inhibitors, and chemotherapy agents. Medications can alter taste to a metallic taste and reduce smell perception. While zinc deficiency can cause loss of smell, also excess zinc can do same. Intaking more than 40 milligrams zinc daily for a long period of time can damage epithelium and cause loss of smell with other symptoms. And diabetes, when uncontrolled, can damage nerves and reduce smell. Smoking also decreases the sense of smell because of damage to the olfactory epithelium due to smoke toxins. Also, the drying effect of smoke on oral and nasal tissue further damages it. Now, let's discuss treatment. Smell therapy, olfactory training, is considered the first-line treatment. In this case, the patient repeatedly smells a set of specific scents like rose, lemon, eucalyptus, clove to retrain the brain to recognize smells. It stimulates regeneration and reactivation of olfactory neurons. It improves smell recovery in 50%, especially after viral anosmia cases. It works best if started earliest, within 3 months of smell loss. This therapy lasts 12–16 weeks to get measurable improvement.
Corticosteroids, because of their anti-inflammatory action, reduce swelling and inflammation of the nasal passages. For this purpose, intranasal corticosteroids are used, usually fluticasone nasal spray. It is effective in the case of viral anosmia, but also in the case of sinusitis and allergic rhinitis. It increases recovery by 20–40% compared to no treatment. Nasal irrigation in the case of sinusitis is also effective. Irrigation with saline solution flushes out mucus and irritants. Vitamins and omega-3 supplements may help, especially vitamin A and zinc, especially in post-viral recovery. For nasal polyps, after a viral infection, smell will recover in 90% of cases. In the case of polyps, smell will recover in 80% with treatment. In the case of Parkinson's and Alzheimer's, the sense of smell will not recover.